right. I feel like I've said this several times, but we're still here. And I'm grateful. Casey Vincent, who is the director of the Rockingham County United Way, has joined me. But before we get started, Casey, we got to take a selfie.
Okay.
Okay, here we go. Ready? How about that? This is testing all my skills today.
I'm telling you, walking and talking is tough for me.
Left-handed selfie, it is for me too. But so we've got to update a couple of things. So with every new person that joins me, I have to update my steps. We'll see where we are.
All right.
Okay. 13,728 steps.
Wow.
I know I keep joking my Fitbit's going to think it's been stolen. That's something, or it's on the axle of my car, I'm not sure. So, Flavel, do we have an update too? We do!
Yay!
So, Flavel and I were telling on our age, but we wish we had the old tote board. You remember the old telephones?
Yes.
That's what we need. Jerry Lewis and all the things we grew up with. So let's see. Wow. So now we've raised $21,650. That is incredible. So
that is wonderful.
Woo! This community, as you well know, we're going to talk about this, is so awesome. Always shows up, always gives back.
Anytime you need anything.
Anytime.
Yes.
Anytime. And sometimes you don't even know you need it. And then here comes something that happens to us all the time. We'll look at the front door of Gibson House and it's like, here comes a load of whatever.
Yes.
And it's like, without even asking, this community is awesome.
Yes.
You can't say enough about small town, rural communities.
I think about that too. Everybody knows everybody, and that sometimes, but most of the time,
Right.
It's the good.
Right.
Everybody knows everybody.
It absolutely is. So tell us what you do all about the United Way.
So I am the director for the United Way of Rockingham County. We raise funds for agencies like yours for specific programs or services that those agencies run. As you well know, raising money is very difficult.
Yes.
And we are fortunate enough that a lot of businesses will allow us to come in and do campaigns for a payroll deduction donation from their employees. And so that's kind of what we focus on in our attempts to raise money. That and individual donations from the public are always welcome.
Got it.
And we also have our own little fundraisers. But those funds we then turn over to you guys, to the different agencies. We work with 16 different nonprofits in Rockingham County. Everything is Rockingham County specific.
Right.
And those 16 agencies have 31 programs and services.
Wow.
That we try to help fund.
That's a lot to support.
It is. And one of the things that I like is it runs the gambit.
Right.
You know, sometimes all agencies' programs are important. All services are important. Some are life-saving, health care, some are education. But when we look at the programs that we support, I can't imagine our county without any of those programs.
Exactly. Exactly. And you know, we talk about, we belong to a collaborative network of nonprofit hospices across the country, but it allows us to remain independent, that nonprofit, same organization that's been here for 38 years. So we do that by a lot of group purchasing, things like that.
Yeah.
But you never want this community to miss something because all of a sudden it's gone. It's like, you might not appreciate it. You know how that, you don't know what you've got till it's gone. We don't want that. Yeah. So we have been a proud partnering agency with the United Way for eons. But so the community knows how we use your funds is for our bereavement program. You know, there's so much support that happens after someone's loved one passes away.
Yes.
And Medicare actually requires that we follow these people and support them for 13 months after that death. Of course, it's at no charge to the family.
And I'm sure Medicare financially supports that.
No, they do not.
Months.
No, they do not. So Medicare expects you to use the money that you received while you were taking care of the patient to fund that 13 months. So without our partnership with the United Way, that just could not be a thing.
And one of the things we at the United Way face out in public when we're trying to get donations and get people to understand what we do, it has a lot to do with they see hospice
Right.
and Cora, they know what you did for their family.
Right.
They had a child that was in the 2nd grade and did the butterfly program from 4-H.
Right.
They know what 4-H did for their family.
Right.
The problem we face is they don't know we paid for that.
Right.
You know, it's
Right.
That's one of the uphill battles we have, is really getting the public to understand the United Way dollars fund those programs.
Right.
And I know not all of them, I think all of them would suffer if they didn't have our funding.
Absolutely.
But there are several that would not exist at all. So to your point of going away,
Yeah.
there are several programs that without United Way dollars would not exist.
So the organizations that partner with the United Way, how can we help turn that public perception around?
Well, one of the things we're trying to do is to be out in the community. We rely on our agencies that when you do things like this, talk about United Way.
Right.
Even if it's only one program in the
Right.
vast array of what you do.
Yeah.
If there's one program that we help fund, talk about that program a little bit.
Yeah.
And let people know what we do. We ask all our agencies to do that. If they're fortunate enough to have a media story done on them or to do their own podcast,
Right.
then to occasionally let the public know
Right.
you're a partner with United Way. I think the biggest uphill battle we have is people think the United Way is this big worldwide organization. And while that is true,
Right.
United Ways operate like franchises.
Right.
So the Rockingham County United Way does not get money from any other United Way, nor do we send money to anywhere. What's
So
raised in the county
stays in the county.
Yes.
Yep, I love that.
We laugh. I said, there is one exception. If the person donating the money wants to split it, say
Right.
they live in Virginia and they work in North Carolina.
Gotcha.
They can split their donation and we will send it to their United Way.
I gotcha. But the vast majority
Yes.
certainly stays here.
Yes.
Well, as we were talking earlier, so our grief services support person, Kristen Honeycutt, was here walking with me earlier, and we were rattling off all of the things in the bereavement program that she does. And everything from the virtual support group to, they had an event last night called Hope for the Holidays. And it's interesting that 8 people came to the group. Half of the group had been served by Ancora. Half of the group just came from the community because they needed the help. So again, partnering with the United Way, you're helping us reach people that we didn't even serve their person.
Exactly.
Yeah. So, well, that is good. You know, we have a monthly podcast, so now you got to come. So now, see, and now you're on camera, and we've got documented proof. So,
Yes.
But that would be an awesome episode for us, and maybe that's a way we can help kind of reverse some of that.
And we've been working on our presence in the community more as well. The United Way historically only did the employer campaigns.
Gotcha.
And so as businesses in this area closed and left, we really did start facing, we weren't reaching as many people
Right.
as we had historically. And so we had to do a strategic plan. We had to change kind of how we operate and how
Yeah.
we reach people. And so that's what we've been focusing on for about the last year and a half,
Okay.
is trying to reach more people. So we've done more public-facing events than we typically do. You know, we've always done the coffees to bring out the business
Right.
people and that kind of stuff, but we participated in 3 different festivals this year, having a presence in Mayodan, Eden, and then one in Reidsville where we talked with people. We did Stoneville, so we did 4. But talking to the public and letting them know who we are and what we do.
Yep. You know, and I certainly understand the uphill battle of thinking United Way is one. We still hear hospice is hospice. Oh, I thought you were all the same. It's like, no.
Yes, yes.
So sometimes that is such the challenge, just
Yes.
like, oh,
Well, and I know with y'all's name change,
Yes.
that's kind of been it, because I get calls now. you
Yeah,
know,
I'm sure.
that I didn't used to get.
I'm
And
sure.
like, no, they're still
it's
hospice.
still, that's right.
Yes, they're
doing
still,
business as.
They weren't bought by anybody. They're
That's right.
still independent. They're still specific
Right.
for the county.
Yep. And you know, that is a reasonable explanation when you see that name change, especially in healthcare with all the mergers and all the things. But of course, we did that because we're more than hospice now.
And yeah, that's what I explained. I said,
Yep.
you know, have you heard about the palliative care
That's right.
program?
That's right. Now we
You know.
got the counseling center. So
Yes.
just wanting to be, we never wanted the name to be a barrier You know, if you were looking for true counseling or you were looking for palliative care, you're not going to call Hospice of Rockingham County. So
Yep.
that was really but sometimes changing that public, especially if you've known us, in all fairness, for 36 years as Hospice
Yes.
of Rockingham County, that's a hard thing. So thinking about our county and all of the people that and the programs that you guys support, what are the barriers you see families facing, and how can all of these partnering agencies, how do we break that down?
It's a real struggle in a county that's not only as rural as we
Yeah.
are, because we have such rural pockets outside of, the 3 metropolitan
Right.
areas, if you can call them that.
Right?
There's a lot of services our county needs that we don't have. So how do the existing agencies try to fill that gap? And working together to do that. I think the things we do well, I think all of our agencies work well together in an attempt to not duplicate services.
Right.
So that we're trying to hit needs that aren't being met.
Right.
And not duplicating programs. I really wish we did a better job of helping what I consider the homeless population, the neediest of ours, because we're so rural.
Right.
We don't have a specific program anywhere in the county
Right.
to help with that. We do have a couple of places that in the wintertime,
Right.
you've got the outreach over in Eden.
Right.
And then I know Salvation Army can do 1 or 2 nights
Right.
of emergency assistance. But other than the wintertime, we really don't have anything to help.
Yeah.
And it's very frustrating as someone in the nonprofit world
Right.
to know when
What's
I
the
get that
solution?
phone call,
Yeah.
there really isn't anything it's really frustrating because it's either your situation is so bad
Right.
that you're to the point where, okay, you need to call like emergency assistance. I mean,
Right.
you need to call someone to come and get you.
Right.
Or you need help with your rent. It's that in between that we
Yes.
really can't help.
Right. And, if we're perfectly honest, we're all one medical emergency, one
Away from being
accident,
there.
exactly.
My friends and I talk about this. We are fortunate enough that maybe we have a couple of weeks,
Right.
maybe a month, if we're honest,
Right.
of emergency funds that if something happened.
Right.
But to your point, one car accident,
Yeah.
one fall down the stairs where
That's
I
right.
break the leg, and I'm
Yeah.
potentially in the
There we
same
are.
boat as most of the phone
That's
calls
right.
I'm getting.
That's right.
And that, I think, is what's scary to me, that we are so rural, we don't have that safety net here
Yep.
that places larger than us, like Greensboro, have.
Right. And that is something that certainly, maybe all the other partnering agencies are going to go, really, Lynn, about that. Maybe we just need to come together and have one thing. What can we do about this?
Yeah.
And start that strategic plan towards.
Well, I know that there is some work around that, some talk around that. I think the issue we really run into is as much as we try to not overlap
Right.
and try to support each other, we're still in our silos
Right.
of what can we accomplish.
Right.
And I think that's part of you've got agencies that are doing their best to
Yeah.
help that population. But it's just difficult. And the bigger thing I think is the money's not there. And that
Right.
is, as much as we try, and there are wonderful people in this county that do a lot to help us.
Yeah.
We're not talking about, a few $100,000.
Right.
You need several $1 million
Right.
to have a true
This needs to be
homeless
some
facility.
gigantic grants
Yes.
from somewhere. Yes.
And you have to
Agreed.
have someone lead the charge on that.
Right.
And I think that's kind of where maybe this group that's working together will come up with, okay, who can lead the charge
Right.
for that?
Right. Gosh, there's a lot of heavy things that we try to solve and try to make better, and goodness. So, well, one more. There's even more issues than that. Of course, there's so many we could just start listing.
We could be here all day.
We could be. We absolutely could be. Thinking about some of the patients that was running through my brain, we've actually served people who were living in their car. living at a hotel. Our social workers have had to find, like emergency something for a night or two for somebody. Of course, we have respite care that we can offer at Gibson House, but to your point earlier, that's 5 days, and then we've got to make another plan.
Yes.
So all of the challenges, but as you're trying to support people through a very challenging time anyway. So.
Well, and I tend to focus on the physical.
Yeah.
I mean, the emotional is extremely important. Education is extremely important.
Right.
But one of the things that hurts my heart is knowing someone's living in their car.
Right.
Because they can't afford a place to live.
Right.
Then the emotional toll that takes. And then, we've had situations where, there were children involved. And it tears at your heart.
It absolutely does. Yeah. So we get back to these fantastic group of mission-minded people that we feel called, you got to do something.
Yes.
It's just humanity. It's that connection, and you have the compassion, and you want to fix it. You want to fix it. Well, I did not necessarily, we'll switch gears a little bit. I did not prep you for this, so I don't even know the answer. Do you have a personal hospice story? Is there?
Well, I have family members who, yes, have been at hospice and taken care of. My grandfather, probably about 5 or 6 years ago, I think would have been the last.
Okay.
But through that experience, and then through a very dear friend of mine's experience, which is a lot more recent, can never sing the praises of hospice enough.
Good.
What you guys do and how you work with families. My grandfather, his particular story, he was a short stay. He developed he was 86 or 88, but he developed a urinary tract infection, which went untreated because we did not realize he had it, which is frequent with the elderly if they don't let you know. And by the time we got him, it ended up in an emergency situation at an emergency room, and I believe he had turned sepsis and was sent to Gibson House. And he was there for less than 24 hours. But just the caring, the staff, the way you are there for the family and support the family. And then, the offer of the assistance afterwards for the emotional. I mean, I don't think the program was as big then as it is now, because it was several years ago, probably 10 years ago. But it was there then. It was, can we do anything? Do you need to talk to anyone? Particularly for my grandmother. But their story was one where within 2 weeks, she followed him, which is also not uncommon. It is
not uncommon.
For people who were married 65 years.
And how beautiful is that? But that broken heart syndrome is a real thing.
Yes, it is.
That is a real thing. Well, we always appreciate people trusting us with the people that they love. Because, that never goes unnoticed. That is always extremely humbling for us.
Well, I can tell you, my experience with the people of this county and their support of hospice through the United Way donations that we receive. I was on the board prior to becoming the director, and I've been the executive director since 2016. And in those 9 years now, hospice continuously is our highest direct designation giving.
Wow.
So we offer 100%. If someone gives to the United Way and they direct that designation to a specific program that partners with us, 100% of that designation goes to the program.
Oh, wow.
We don't keep a penny of it for administrative costs. It all goes. And for the 9 years I've been director, you guys are always our number one designation.
That is awesome. But you're hard pressed to find somebody that doesn't have some connection. It's either personally or like my dear friend just had. It touches everybody, but I am so grateful for that. That is it's always just so incredibly humbling. So, well, as we wrap up our time, you were talking about the campaigns that happen inside businesses. What would happen? What if somebody's retired, or maybe they're just not connected with somebody that has a campaign? Is there a way for individuals to donate to United Way?
Absolutely. If they are comfortable donating online via credit or debit card, they can go to our website, which is uwrockingham.org, and they can donate that way. They even have the ability to designate it specifically that way. If they're not comfortable doing it online or would prefer to write a check or anything like that, they can reach out to us at 336-342-7768 or online via email and let me know. And I can make arrangements with them to either mail in a check, I can come by and pick up a check, anything like that.
Okay.
Absolutely.
Awesome. Well, now, again, we have documented proof, so you're on the hook for a podcast. Roy helps us with our podcast, so now, you know, sooner or later you'll get a phone call from me. And I'm grateful that you brought that up, because that will be a wonderful way that we can communicate our partnership to the community. So
thank you.
I appreciate all that you do. We appreciate our partnership with the United Way, and again, supporting that bereavement program would not be possible without that partnership.
And we appreciate what you do for the citizens of Rockingham County. One thing I want to mention along those lines, the county does a community health assessment every year, annually, in conjunction with the two hospitals.
Gotcha.
And United Way helps to participate in that. But I want the public to know the programs and services that we fund come out of that. So we are trying to fund programs and services that the citizens of Rockingham County have deemed as important.
Oh, that's a huge point.
Yeah.
Yeah. Thank you for bringing that up. So, well, I hope you have a great rest of your day.
Well, thank you. I've enjoyed my little stroll.
See, we've knocked out two birds with one stone.
Absolutely.
There you go. It's good to see you.
Thank you, Lynn.
Thank you.